this is what goodbyes are said for, but I don't even know.
Good day, welcome, welcome. Everyone, take a moment. You can turn your cameras on. If you are tuning in from a cell phone, you see the little icon at the bottom left of your screen. It should tell you how to turn your cameras. A little camera icon, click that, cameras will be on. Yes, yes. I see Kathleen in the building. Good day. Lovely smiling face, Kathleen. Welcome, welcome. Cameras on, good folks. Pack up every morning and good night. I want the sunrises and moons. Taking all my kisses back. All my kisses back for you. We got another smiling face in the gallery. Welcome, welcome. Good to see you, Rose. Hello, I see someone else in the chat. Is that a Coco in the gallery? Welcome, welcome.
Always sweet enough things I said, where your legs would cross me in bed. Motion pictures you took of us, lost the color.
Everybody, to make sure that you good folks are good with the chat, let me know what you had for breakfast in the chat. I hope you guys have eaten something for the day. Let me know in the chat what you had for breakfast. Some tea this morning, had some fruits over here. Yes, what you guys have for breakfast, let me know you know how to use that chat. Oh, someone's eating good. Someone's eating good. Eggs, pancakes, tea, yes. Rose has got her banana on deck. I had a banana too, Rose. I had a banana too. Everybody had tea, right? In the chat, let me know, are you a tea person or a coffee person? Tea or coffee? I'm tea myself. I'm not really big on coffee. Like, Rose, I'm gonna get you in that chat. I wanna see you in the chat. In the place. Good day, good day. And you good folks know how to use the chat. Yes, yes, yes. All right. That's what I need to see. We'll begin shortly. Just want to make sure that everyone is acclimated with the chat. Everyone has the cameras. We're good to go with that. Okay. Hi, everybody. Good day, welcome, welcome. I'm so excited to see all of your wonderful smiling faces. Yay. So I see everybody had some breakfast. I think only one person ate because I got tea and one meal, but at least you good folks know how to use the chat, all right? So today we're gonna be talking about management of care, but before we get in, you know, I always like to do a nice little icebreaker with you good folks, and we typically start with a 5-second rule. But before we go there, I just wanna make sure that everyone has their cameras turned on. If you are tuning in from your cell phone, if you tap your screen, you'll see on the lower left-hand side, there should be a nice little camera icon. When you press that, that will activate your camera, and then you can start to share. If you are tuning in from a laptop, then on the bottom of that page where you have the options there, you can see the little camera icon, and that is how you would be able to turn on your cameras and start the view of your beautiful faces. Yay, yay, yay. All right, so a lot of you folks have been here before. You know what the deal is. You know how to mute and unmute yourselves, right? All right, so you know what? Let's get it going. Let's first jump in with our little icebreaker, and we can play 5-second rule. All right, good people. So as you know, the name of the game is 5-second rule. How that goes is I'm going to call on a person. That person will then unmute themselves. I will ask you a question for which you will have 5 seconds to answer that question. Is everybody geared up and ready in the Galleria? All right. So let's see. Rose, let's go to you, Rose. You get to be lucky number 1. Unmute yourself. Oh, look. Oh, she. Oh, you were quick, honey. You were quick with it. I like it. I like it. All right. So, Rose, good day to you.
Yes. Yes.
Are you ready for your 5-second rule question?
Yes, go ahead.
Okay, in 5 seconds or less, tell me 5 tools or instruments that, not even, I'm gonna break that down. 3, give me 3 tools that a nurse would have on her at work.
Tool.
Yeah, like this could be a tool. You know what I mean? Uh-huh.
Blood pressure monitor, a glucose monitor.
Oh, okay. You on a roll. She got that. You got that. Thank you, Rose. That was your 5-second rule question, and you killed it, and you unmuted yourself like a true champion. Does everybody see that? Look at that. Rose is on a roll. All right. Kathleen. A good day. How are you today?
Okay, thank you.
All right, look, you're smiling, you're smiling.
I can see you okay, you look beautiful.
Thank you, so do you. So listen, I'm gonna give you your 5-second rule question. Are you ready?
Yes.
All right, since you came in smiling so great, give me 3 things that can make a patient smile.
Give a joke, medicine, and some love.
Aww. I love it. That was beautiful. That was beautiful. Thank you so much. You did amazing. All right, moving on. We got to make sure that our resident gentleman in the gallery is able to unmute himself. So Mr. 16076, since that is your name. Coco, good day to you.
Good morning, Miss Tia.
How are you today?
I'm amazing. I'm good.
Oh, listen, I love it. That's what I like to hear.
You look great.
Thank you. So do you. It's good to see you. So, Coco, are you ready for your 5-second rule question?
I'm not used to it, but I'll try.
All right, so let me just let you know. I'm going to ask you a question. You'll have 5 seconds to give me the answer. You got this. So, since you just had a nice little baby, give me 3 ways to get that little baby to go to sleep.
Okay, Moby's music, a bird before she sleeps, and her bottle of milk.
Aw, and how is that baby?
She's 4 months right now.
Oh, yay! Congratulations again. All right, great job, Coco. You killed that 5-second rule. All right, everybody. So everybody should be nice and greased up and ready to go, right? Right. Okay, so without further ado, let's jump in. All right, I'm gonna share my screen. You good folks should be able to see our first slide here. All right, so we're gonna jump into management of care, okay? The objective here today is to learn how to approach this subject matter of management of care in terms of the NCLEX exam. Then we also want to be able to apply these strategies to answer these questions correctly. All right, this is very important. I'm sure you folks have heard me say it before, okay? Very important. When you are taking these tests and you're looking at the questions, do not choose answers based on decisions that you've seen at work, okay? If you've seen them do things in your clinical experience or your hospital settings, those things do not count. Unfortunately, a lot of times the things we see in real time are not as per the book. So when you're taking these tests and you're listening to these or reading these questions rather, you want to approach it in a way that the nursing books, the textbooks, and the journals are saying to do it, all right? So again, do not base your answers on any decisions that you saw at work. It will trip you up every time. All right, good people, please tell me you've got that. All right, thumbs up, okay? All right, so what does management of care mean? What does that mean for the RN? I'll tell you what it means. So management of care suggests that the RN is going to be providing and directing nursing care through a delivery setting to protect the client and the healthcare personnel. So that's not just the patient, but it's also the subordinates that we're delegating to, right? Who could those personnel be? In the chat, let me know, who might some of those personnel that we need to consider be? In the chat. Let me know in the chat, who are some people that we're referring to when we talk about healthcare personnel? Don't forget what the NCLEX exam is going to be asking you, right? Management of care. It's not just about the clients. It's also about who you're going to be delegating to, right? So who might those personnel be that you as the RN is going to be delegating to? Let me know you know how to use that chat, good people. Yeah, we got UAPs in there. What about the LPNs, right? So don't forget that. Again, it's not just about the clients in terms of managing care. It's the client. Exactly. It's the clients and the healthcare personnel. All right. So basically, when you're taking your NCLEX exam, you can expect about 20% of the questions on that test to cover this particular area of practice. So how does this segment affect or impact the role of an RN? As registered nurses, our responsibilities are inclusive, and that also would include assigning and delegating client care to staff. That is important. We've talked about this before. That is one of the major and primary roles of the RN. Congratulations, we got a baby in the gallery. Extra points for a Coco. All right. Also, it is going to be our responsibility to follow ethical and legal standards of care and practice. Do not forget that, good folks. Maintaining strict client confidentiality. In the chat, let me know what rule covers this particular aspect of nursing. What is it called? What is it that we have in place that maintains our clients' confidentiality? You're closer, Coco. Exactly, HIPAA. We have HIPAA. HIPAA is the rule or law in place that states that as care providers, we have a responsibility to maintain client confidentiality. So that means if I'm taking care of a client on our unit, maybe a Coco works on the unit, but he's not caring for that client. I don't get to go and blabber about things that are directly related to the care of that client with anyone who is not directly taking care of said client. Does everybody understand that? Thumbs up, let me know. We're minding our business and minding our clients' business as well, right? Okay, So prioritizing and organizing efficient client care. Why is this important? Because the staff, the personnel that we referred to earlier, they're going to be the ones that we're going to utilize in order to prioritize and organize care. We're going to be responsible for that, making sure that the right people are assigned to the right task as per their job descriptions. And that's important for us to know, all right? Educating the clients and their families. Remember that acronym that I gave you, good folks. What is the key to understanding the role of the RN? It's something that's sticky. Let me know in the chat. Let me know in the chat. Does anybody remember? How are you gonna know what task cannot be delegated to anybody else? It's that sticky little acronym I gave you, good folks. Kathleen, I know you know it. I see it in your eyes. Tape. I knew she wouldn't let me down. All right, Kathleen, you're up. I want you to unmute yourself and let these good folks know what each letter represents in tape. What is tape?
Oh my God, I forgot.
Oh, someone help Kathleen out. Does anybody know what tape stands for? Each letter represents something different, okay?
I got it now. Teaching, assessment, planning, and evaluation.
Okay, say it again a little louder. Tape, what is tape again, Kathleen?
Teaching, assessment, planning, and evaluation.
That's what it is, right? Teaching, assessment, planning, and evaluation. So again, if any question that you're coming across requires any of those activities, that is an RN only task. You cannot delegate it. An LPN should not be doing it. Nobody else but the RN should be doing those tasks, okay? So as long as you remember tape, you're 10 steps ahead of the game, because now you're like, if this option is telling me that there's teaching involved, if there's an assessment involved, any care planning, and then evaluating, those are all RN specific tasks, and you'll be, again, 10 steps ahead of the game. You'll know what's going on. Great job. All right. So what are some other roles that the nurse will have to care for within this management of care? All right. One other thing is, besides educating the clients and their families, we're going to be participating in interprofessional care. So interprofessional care is regarding other members of the team that have something to do with that client. All right. So we're a big part of that. And so, as we just said, remember tape, teaching, assessment, planning, and evaluation. If any of these are involved, you are not going to delegate. So remember, tape. There's a nice little beat, Brianna. Yeah, okay. All right, so we're remembering tape, okay? All right, good folks. So the focus in this particular aspect of the NCLEX, and in general, we want to make sure that the RN understands what the role of collaboration is. You have to be able to demonstrate that you can communicate effectively and that you can also coordinate care with every member of the healthcare team in order to facilitate effective client care. Remember, we're goal setting, right? We have our plans, how we want to attain those goals. It's going to require communication and coordination. Okay, good people? All right, so underneath this particular umbrella of things, the specific topics that may be touched or broached here would be advocacy. We know as RNs, we are patient advocates. You're supposed to know and uphold this. Your client has rights. You should know that. Uphold them at all times. Confidentiality, we know this has to do with HIPAA. Continuity of care, care planning, discharge planning, all of those things. The P in tape, right? You folks remember that. Planning, it's a part of it. Ethical practices, informed consents, legal responsibilities, quality improvement, and team collaboration. So this is how these particular questions might be set up. They all fall underneath that same umbrella. And again, these are some points that you should be aware of. Pretty simple stuff, as long as you're keeping in mind that, again, tape, it covers all of this. But again, if it's broken down, you might see questions about ethical practices, informed consent, et cetera, but you'll be prepared because you understand tape already. Okay, so let's get into the rules for management of care. Rule number 1, this should be a familiar one. Do not delegate the functions of tape, teaching, assessment, planning, nursing judgment, and evaluation. Once more, this is why it's rule number 1. It's so important because if you understand that, you will not make the delegation mistakes and you would understand what the role of the RN is. And again, you're 10 steps ahead. So if you hear tape, I want everybody to know what it means. It's important. So that's rule number 1. Don't forget it, okay? Because that's the responsibility as the registered nurse. Rule number 2, you're going to delegate activities for stable patients with predictable outcomes. If you have someone who is stable at the time, but maybe they're post-op, there could be something that can change from moment to moment. That is not going to be someone that you're going to delegate. That is not predictable. If you have a person that has, maybe they just need help with ADLs, we know what's going on. Their diagnosis or pathology has been years old. That is a person that you can delegate because those outcomes would be predictable. So if that client is unsteady or unstable, or if an outcome of an activity is not assured, we are not delegating. If a client has been in bed for a week or 2 and they have been immobile, maybe they're post-op some type of hip surgery or something, that's not that first time that patient ambulates, that should not be delegated. The RN needs to be there. Does everybody understand that? Yes, yes, yes. All right. Good deal. All right, moving on. Rule number 3, delegating activities that involve standard unchanging procedures. Each one kind of piggybacks off the next one. Hopefully you good folks are able to see that. And then for rule number 4, you're going to remember to prioritize. The ABCs, right? That comes first. What do the ABCs represent? In the chat, let me know, what does the ABCs represent? Let me know that you know what the ABCs represent. We already have it in the chat. You can copy and paste if you need to. All right. Airway, breathing, circulation. That is number 1, okay, good folks? Airway, breathing, circulation, okay? Then we're also going to remember Maslow. Does everybody remember that good fellow Maslow? Right, so it's that hierarchy, right? Basic safety, all those things, those basic needs needing to be met. So you're gonna go with the ABCs because airway, breathing, circulation is the priority. And then you're gonna utilize Maslow's hierarchy of needs for the following prioritizations, all right? Everybody, familiarize yourself. It's important. You got the ABCs down, then you're gonna go to the basics of standard care as per Maslow. This is how you're gonna learn how to prioritize your care. It's very important. This is called triaging, okay? So when you're getting a bunch of clients coming in, you need to know who is the priority, who do you need to see first. The NCLEX exam is all about that, all right, good folks? So as long as you're putting these 4 rules to use, you should be ahead of the game, okay? Keep in mind that you can only see one client or perform one activity when you're answering these questions. So that is why you're going to have to get comfortable with establishing prioritization, okay? So activities that require or that frequently reoccur on a daily schedule, day-to-day, that can be delegated. If the client needs help getting dressed in the morning, that's something you can give to the UAP. So as long as you understand, if it's everyday, calm, stable things, you can delegate out. If there's something that's going to change, depending on what the status of that client is, some of those things you can delegate to the LPN, but it can't be critical, okay? All right. So some examples of those everyday things that can be delegated, you can have bathing, feeding, dressing, transferring. Again, these all fall under the ADL category. Activities that are complex, complicated, we know we're not going to be delegating that, okay? All right, good folks, we're up to this lovely part of the breakdown. So here we go. The first question of the day. A child with a compound fracture of the left femur is being admitted to a pediatric unit. Which of the following actions is best for the nurse to take? 1, ask the NAP to obtain the child's vital signs while the nurse obtains a history from the parents. 2, ask the LPN to assess the peripheral pulses of the child's left leg while the nurse completes the admission forms. 3, ask the LPN to stay with the child and his parents while the nurse obtains phone orders from the physician. Or 4, ask the NAP to obtain equipment for the child's care while the nurse talks with the child and his parents. Look it over, good folks. Let me know, put your answers in the chat, what you think the answer to this question is. In the chat, you can go.
Captured effortlessly, that's the way it was. Happened so naturally, I did not know it was love. The next thing I felt was you, holding me close. What was I gonna do? I let myself go, and now we're flying through the stars. I hope this night will last forever. Oh, 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 oh. Ain't nobody loves me better.
I'm going with 1, 2 times. 1, 2 times.
I've been waiting for you.
All right, Ashley, no worries, no worries.
I knew just what
We're gonna break it down, but use your nursing knowledge and everything we talked about in those 4 rules to get to the best answer. You're likely going to be stuck between 2 selections whenever you're taking the test, right? If ever you're not sure, there's likely going to be between 2 answers. So this is what we're going to get to today, good folks. We're going to break it down, break it down, break it down. But do your best, do your best. All right, good folks, I'm gonna give you another minute or so. Let's see some more answers in the chat. Make sure you're reading the questions carefully, read your selections carefully, and make the best decision based on the information that has been provided. All right, 30 more seconds for you good folks to come up with your selections. If you haven't done so already, just put your selection in the chat and we are gonna break it on down. I don't see any new answers up in this chat, so I think we can come on back. All right, good folks. So let's break it on down. Did anybody, I see Ashley said in the chat that she was stuck between two answers. Did anybody else feel like they had two answer choices that they weren't quite sure about? Yeah? So let me know, or unmute yourself. Let me know what were your two choices that you were up in the air for. Ashley said 1 and 4. That was honest. Thank you, Ashley. Anybody else? What were you good folks grappling between? What two answer choices stuck out to you?
I was thinking 3 and 4.
3 and 4. Coco said 3 and 4. All right. Anybody else? Everybody else felt.
4.
What was it, Kathleen?
1 and 4.
1 and 4. Okay, so did most of you folks had 4 in the mix, and you had some other things as well. All right, so no worries. We're actually going to. Yes, Rose.
2 and 4.
2 and 4. 2 and 4. Anybody else have that same combination? No, but I see that there were a lot of 4s in the mix. All right, no worries. All right, so basically what we need to do here is we're going to have to break down the question. So this is what we're gonna do. I'm going to teach you good folks how to then approach these types of questions and then get to the best answer for you. All right, so the first thing we're gonna do here is, like I always say, what is the question asking you? So we're gonna reword the question. We're gonna put the question into our own words at that time. All right, so this particular question said a child with a compound fracture of the left femur is being admitted to a pediatric unit. Which of the following actions is best for the nurse to take? So anybody, what do you hear, or what does this tell you that you're looking for here? Did anything stand out for anybody?
Fracture, left femur, and vest.
So this is okay, so Kathleen said that the fracture of the femur is what stood out, right? Anybody else? Thank you, Kathleen.
The best action for the nurse to take.
The best action for the nurse to take, right? So you guys put those things together, you have what happened. A new patient came with a compound fracture, right? So we're gonna have to prioritize that. This patient has a new injury, correct? Does everybody see that? All right, so now we're thinking about what is the best thing to do for this new client that just came in with this brand new fracture, all right? So everybody got that. All right, so let's jump back in. So the question is asking us what the nurse should do when that child with this fractured femur is first admitted. That question is pretty broad, granted, right? So we're gonna have to figure out exactly what's being asked by going into the question selections, those options, those call options. And that's what the choices are called. They're called call options. So now we have what we can potentially do. Can we ask the NAP to obtain the child's vital signs while the nurse obtains a history from the parents? Ask the LPN to assess the peripheral pulses of the child's left leg while the nurse completes the admission forms? Ask the LPN to stay with the child and his parents while the nurse obtains phone orders from the physician? Or ask the NAP to obtain equipment for the child's care while the nurse talks with the child and the parent? All right, so in each answer that we have, the nurse is gonna be delegating tasks, and it's either being delegated to the LPN or the NAP. Does everybody see that with all those choices? Yeah. All right, so we know that this question, the answers require delegation. So with that, what's the first thing we should be thinking when we see a delegation situation? Let me know. Let me know. I said it 3,000 times. I said it 3,000 times. I like to see it in the chat. Let me know what you good folks think should be, we should be looking for when it comes down to prioritization and delegation.
I quit my job
In the chat.
and I want to go to my ghost without trouble. My scars all closed and I just wanna love. I will never let you down. I just need to see a new landscape. I just need to breathe in handscape. Everyone has a dream like me. I will travel in the galaxy. I will kill all my enemies, but I do anything to stay me and stay free. Stay free.
I see it in the chat. I need to see more of it. I see it in the chat. I need to see more of it. Someone got the right answer. Oh my. All right, good people. It's tape, right? And what does tape tell us? Teaching, assessment, planning, evaluation, right? These are the things we need to keep in mind. We know that each selection that we see is a delegation question. So we need to be mindful of what can and cannot be delegated at this point, okay? So the real question here becomes, what is appropriate delegation in this particular setting? We have this child that is newly admitted with a compound fracture, and each question is requiring us to delegate an action or a task to assistive personnel. So everybody sees that, correct? All right, so the next step would be to eliminate answer choices based on those rules of management that we went over, okay? So let's get into it. The first option here was to ask the NAP to obtain the child's vital signs while the nurse obtains a history from the parents. All right, a lot of you good folks had number 1 in the chat, and Augustina had number 1 2 times, okay? So let's ask Augustina. I'm gonna ask you to unmute yourself and just let us know what was your rationale behind picking this particular selection.
First of all, the nurse have to assess the client. So while assessing the client, the baby cannot talk. You have to
Hang on a second, I'm trying to bring you on back. Or maybe it was the electric heavens that opened up and was like, you know what? We'll let you off. All right, so no worries. Augustina, if you can, just go back, unmute yourself and continue. You got cut off a bit.
all right. What I'm saying, you hear me now?
I can hear you, yep.
Yeah, what I'm saying is that the child cannot talk. He cannot explain himself how it happens. So the nurse have to get the inquiries from the family. What happened? How it happened?
All right, so I'm gonna stop you there because I feel like you're reading too much into the question. It didn't say any of that, right? So we wanna make sure that we're not putting extra things in our heads when we're approaching the question, right? So we're reading the question and then we're taking the information from the options that we have provided to make the best determination, okay? So do not get caught up in extra things. We said in the beginning also, do not get caught up on things that you've seen on your units, on, in the past places that you've worked. We're not using those things as examples. So we're staying very focused on the question, what the question is asking us and rewording it. But Augustina, you did make a great point that the nurse is the one that has to do the assessment, okay? So with that being said, let's look at what that first option was. So if you selected number one, then number one said that you would be asking the NAP to obtain the child's vital signs while you're taking a history from the parents. Now, in that particular setting, who is now doing the assessment? You see? You see? Right. So with number one, if you chose that option, let's look at it again. The NAP is now taking the child's vital signs while the nurse is talking to the parents and getting a history. Which is more important for the nurse to be doing at that time? It is an assessment, okay? So again, obtaining vital signs, that is an assessment. As per rule number one, what can't we do? That is the second letter in TAPE. We are not going to be delegating assessments. So we can't do that. Number one is wrong, okay? Eliminate that. There is no delegation of assessments, okay, good folks? All right. So now selection number two. I know a couple of people said they were between 2 and 4, so let's break this one down. This one gives us the option to ask the LPN to assess the peripheral pulses of the child's left leg while the nurse completes the admission forms. Right? So again, what did we talk about? Tape, 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 right? What is this selection saying to us? Who was it that said? I think it was Rose. Rose, was it you that was between 2 and 4? Was it Rose? Okay, so Rose, let me know. For question 2, what was it about this particular selection that drew you in? Oh, Rose, you're still muted. I know you just want to go right in and just start talking, but we can't hear you, girl.
No, can you put it back?
You're good. I can hear you. You're good.
Okay, can you put number 2 back? Thank you.
Can you see it?
Yes. Oh, number 2 is wrong.
It is.
Because LPN cannot assess.
Exactly. We are not to delegate assessments to LPNs, right? So
Yes.
don't get caught up. Don't get caught up. Don't get
Right.
caught up. So now we see that. All right, so 2, checking of those peripheral pulses, it's important, but it's an assessment. And it even said it in the question stem itself, right? The LPN is to assess peripheral pulses. If we're paying attention to tape, that should stand out like a big red flag. Assess
Yes.
LPN. Oh no, we're not delegating that. We're not going to have anybody else do that. So that's not what we want there, okay? So the nurse needs to assess client before you're delegating anything else. And it's definitely more important for the nurse to be assessing the client before we complete any of our paperwork. The paperwork becomes secondary. Assessment is the priority there. So with that being said, we know now that we can. Does everybody in my lovely gallery see that? Yeah, yeah, hallelujah, hallelujah. All right, so we're gonna eliminate that one. Number 3, did anybody have number 3 selected? I think Coco was between number 3 and number 4, right? So let's break this one down. Ask the LPN to stay with the child and his parents while the nurse obtains phone orders from the physician. What do we think about this one? Is there any assessment? Is there any teaching? Is there any planning? Is there any evaluations here? Let me know in the chat. What are you good folks thinking? What do you see here? And are we gonna consider this or no? Mercy says no. What else do you good folks say in the gallery? Let me know, let me know.
Quit my job and I want to go to my girls without trouble. My scars all closed and I just wanna love. I will never let you down. I just need to
No,
see
these do not have
you
any of the
escape.
tape in it, correct? So
I
far we're
just
seeing
need
no
to breathe and
tape.
escape.
Anybody?
Everyone
Not very important. What does that mean? Mercy, I'm gonna come to you in a moment. Does just let people fill in what they think, and I'll come to you in a moment to hear more of what you think, my love.
But I do anything to stay me and stay free. Stay free.
Okay, so we're gonna come to Mercy. Mercy, can you just unmute yourself? Let me know what you were saying with the not very important. What does that mean, girlfriend?
Hi, Nurse Tia. Good morning.
Hi, good day to you.
Thank you. I feel asking delegating the LPN to maybe watch the child as she takes and call from or give a call to the physician. It's not as important as attending to the child.
So we feel like we can consider this. Should we keep this one in? We can keep it in for consideration? Let me know in the chat. Tell me in the chat, do you feel like this can be a contender? Can we keep this in? Are we keeping this in for consideration, option 3? Or are we eliminating this? Are we saying on this option? Let me know in the chat. Yes, we're considering it, we're keeping it, or no, we are letting it go. I see some letting it go, eliminate. No, we're letting it go. Patricia says no assessment here. So are we keeping it then? Can we keep it for consideration, Patricia? Are we keeping it in for consideration, Patricia? There's no assessment here. Augustina says, no, we're not keeping this for consideration. I see some head nods, yes. You guys are like nodding yes with the head and saying no with the hand. I hear you.
Remember, the life is hard.
All right, let's jump back in. Okay, good folks. So with this particular selection, let's break it down. All right, so as Patricia stated, there is no assessment, right? So in a Coco as well, was like, we could keep it. So there's no assessment here. There's no tape. There's no evaluation. There's no nurse in judgment. So we can actually leave this option in for consideration. So if you were stuck and 3 was one of the options, then it makes sense. This particular selection had no assessment. At least we got to the ones that had tape and that did not have tape. Does everybody see those differences? Please tell me you do. Okay, so this one we can leave in for consideration. I want you good folks to remember that the NCLEX exam, the emphasis is going to be placed on providing care to clients according to how nursing care is defined in the textbooks and the journals, not by what you see on your units, okay? So we know that, all right? A lot of times it's not what's supposed to be happening. Okay, so for number 4, let's break down number 4. A lot of folks had this as an option, so we're just gonna get right on into it. Asking the NAP to obtain equipment for the child's care while the nurse talks with the child and his parents. Did everybody have 4 as an option, other than the people who had 1 3 times, right? Other than the people that were certain with 1, how many folks had 4 as an option? Just put your hands up in the air if you have 4 as an option. All right, so let's see. We got 3 people who have 4 as an option, so let's break this one down, okay? All right, good folks. So with 4, the nurse is with the child and the parents while the NAP obtains needed equipment. There's no tape here, okay? No assessment, no evaluation, no nurse in judgment. They're just getting equipment. So this is a choice that we can leave in for consideration. It makes a lot of sense, okay? So now, here we go. What have we done? We've eliminated 1 and 2 as per what we were supposed to do, the rules, right? So now we're eliminating the options that don't make any sense to us. We know for a fact these are not true. We're approaching each option like a true or false. These 1 and 2, they are false. So now we're left with 3 and 4. Okay, 3 and 4 could potentially be our answer. So let's see. Oh my God, what is it? Next step, we're gonna select an answer from our remaining choices. This is how we're gonna break it on down. We got answers. Ooh, I went a little fast, went too fast, went too fast. So we got 3 and 4, okay? Bear with me. Here we go. This is what we left with. All right, so now we got those 2 answers. Let's break it down more. Number 3, this indicates that the nurse is on the phone while the LPN is with the client. Have you guys ever seen this done in the real world? Probably so, okay? But is this what the nursing textbooks and journals say we should be doing in this situation? Probably not, right? We're not going to do that. So guess what we can do? We can eliminate this answer, okay? It was one of them that we can consider, but the question said, what is the best? What is the best choice here? And the best choice is not to leave the client to go talk on the phone or anything else. You could do it all, right? 3 is not the best answer. So now we can eliminate that. So the correct answer here is 4. That nurse is caring for the child and the parents while you're delegating other tasks to the assistive personnel. The assistive personnel can go get that equipment. There's nothing wrong with that. There's no tape involved, okay, good folks? So we're here now. And each of those answers, again, the RN is delegating. So the question that we should be asking ourselves is, what is appropriate delegation? And again, remember, the emphasis is going to be on providing care based off of what the text and the journals say, not off of what we see in our units and our hospitals, which are usually, unfortunately, not the right thing to do. So we're going to break out on that idea. We don't want to do what we see. We want to do what we know to be correct as per the text and the journals. Okay, good folks? Great job, everybody. Great job. All right. So let's review this. Does everybody feel like they were comfortable with the breakdown? Does everybody see how we applied the rules of management in order to get to the correct answer? I hope so. Gallery, let me see. Want to see those head nods? Let me see those head bobs. If you got it, let me know. Yeah? All right. Okay, good deal. All right, so what better way than to break it on down again, okay? We're gonna have some management of care NCLEX-style practice questions, okay? So first one up, which of the following tasks is appropriate for the nurse to delegate to an experienced NAP? 1, obtain a 24-hour diet recall from a client recently admitted with anorexia nervosa. 2, obtain a clean catch urine specimen from a client suspected of having a urinary tract infection. 3, observe the amount and characteristics of the returns from a continuous bladder irrigation for a client after a transurethral resection. Or 4, observe a client newly diagnosed with diabetes mellitus, practice injection techniques using an orange. What do you good folks think is the answer here? Use the same principles that we just went over, and let's get to it. I believe in you.
Makes me happy, makes me feel this way. Ain't nobody loves me better than you. Ain't nobody loves me better. Makes me happy, makes me feel this way. Ain't nobody loves me better than you.
I see a few answers coming in the chat. Continue to good work, good people. Keep thinking about it. Make sure you're applying the rules of management here. I believe in you. Another 30 seconds or so for you good folks to put in your selections in the chat. Kathleen looks confident. She looks confident. She's like, I think I got it. All right, good folks, couple more seconds. All right, good folks, let's get back to it. The first question I'm gonna ask you is, what is the first step? In the chat, let me know. What is the first step to approaching this question as per the rules? What should you be doing first when you see this question? Let me know in the chat. In the chat, what is rule 1, the first step to approaching these questions? What should you be doing? MVP points to the person who drops it in the chat. What is the first thing? Ashley's close. Ashley's close. I'm sure some of you can hear me in your head when I'm telling you what to do, when we're doing reviews. What's the first thing that I tell you, good folks, how we approach these questions? In the chat, MVP points to the person who gets it in the chat. Man, my chat is dry. Considering tape appropriate task delegation for an NAP, that's a good point, but that's not the answer to the question. All right, I don't see any more answers coming in, so let's get back to the question here. And so what I wanted to know, what I was asking is, what is the question asking us? That's what I wanted to know. What is the question asking us? Step 1 would be that we need to reword the question, put it in our own words, right? What are we going to assign the NAP? That's the question, okay? So let's break it down. Eliminate answer choices based on the rules of management. Don't forget that. So the first one, did you pick 1? Obtain a 24-hour diet recall from a client with anorexia nervosa. You might consider this one an option choice because eating is a recurring daily task, but that's not what this question or this selection is about. It's not about feeding. What is unique about this particular selection? Number 1. In the chat, let me know why this is not just about eating and it's not just a daily situation. Anybody in the chat, let me know. Or if you feel bold, unmute yourself, let me know. Why is this just not asking about eating? What is unique about this selection?
I think because of the patient's diagnosis.
Exactly.
Yeah.
The diagnosis, this client has anorexia. It's not just about a daily food thing that you're going to delegate to somebody else. This client specifically has a diagnosis that has an issue with feeding. Does everybody see that?
Yes.
Right? So it's not about eating. If it was just a regular client that maybe, you know, client has a soft diet and now they're going to be eating, you know, pudding. That's what eating a daily recurrent situation would be okay. But again, the client's pathology, the diagnosis lets us know that is not something that we want to delegate because that actually involves tape. Does everybody see that? If a client has anorexia and we're talking about food and feeding, that is a tape situation, okay? Eating, as we just said, it has a special significance when you're talking about anorexia, okay? So it's gonna be a little bit different with that, all right? So an important assessment that the nurse should be making is the quantity of food that the patient is eating, because once again, this client has anorexia. What is anorexia? Let me know. What is anorexia?
Eating disorder.
An eating disorder, but what specifically does anorexia indicate? Because there's a lot of different eating disorders, right? Is anorexia the same as bulimia? Nope, but they're both eating disorders, right? So what is unique about anorexia?
I think anorexia, it has to do with patient not wanting to eat enough food because they are so cautious that they will gain weight. But malnutrition is a
You hit it on the head. Anorexia is not eating, a lack of appetite, right? So they're not eating food. So this requires tape. So we want to make sure that we're assessing the quantity of the food that these particular patients are having. So that would not be something that we would delegate to NAP, okay? So we would then eliminate this option. So it is not the best choice for us. Number one, if anyone had that one, we're eliminating it. It is not what we want, okay? So number two, for number two was to obtain a clean catch urine specimen from a client suspected of having a urinary tract infection. Did anybody have number two as their selection? Let me see your head nod if you had number two, if you had number two. All right, we got a couple of people that had number two. All right, so let's jump in. Let's see what's up. So as per rule number 4, it tells us delegate activities that involve standard, unchanging procedures, okay? So with this particular question, there is not an indication that this client has a catheter, so this would be a routine procedure. So because it's routine, now we can keep it in for consideration. It is still in the standings for correct answer, so we can keep it. If you chose number 2, it's still in the running. We can consider it as our answer, okay? So let's see, number 3, observe the amount and characteristics of the return from a continuous bladder irrigation for a client after transurethral resection. Head nods in my gallery. Did anybody have number 3? Anybody have number 3? Head nod if you had it. I got a lot of no's. So nobody had number 3. Augustina had number 3 potentially. All right, so we got 2 head nods for number 3. 2 head nods for number 3. All right, so let's read the question again. And let me know what keywords, all my gallery in the chat, let me know what keywords here stand out to you, okay? So I'm gonna read it again. Observe the amount and characteristics of the returns from a continuous bladder irrigation for a client after transurethral resection. My gallery members, break this statement down. What keywords stand out to you? Oh, that was quick. I got observe, assess, right? Observe, assess. What does that tell us? That is an assessment. Observe the amount and characteristics of return. If they are observing the amount and characteristics from the return, then they would be assessing that, right? Is that not an assessment? Does everybody see that that in itself is an assessment? Do we delegate assessments? My gallery, shake your head. Let me know, yes or no. Do we delegate assessments? Because that's in TAPE. That's the second letter of TAPE. We know this, right? All right, so the color of the fluid needs to be assessed to determine if there's any hemorrhage. That is an assessment. Thank you to my wonderful gallery who, thank you. It was a Coco and the rest of you lovely gallery people who said, this is observing. Observing means to assess. We can eliminate this. So don't be shy to pick up on those keywords and listen, they're synonymous. Observing, assessment. So if you see that, what are you gonna think? Tape, 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 tape. No, this person should not be doing that. Okay, good folks? So now let's jump in. We got another selection here. Number 4, observe a client newly diagnosed with diabetes mellitus, practice injection techniques using an orange. All right, in this one, my good folks, I want to hear from maybe a Augustina or a Patricia. Let me know what is the keyword in this particular selection that might lead you closer to your answer. Is this a true or false situation? Is this something we are going to delegate to our NAP? I see head shaking no. I see head shaking no. Patricia, are you able to unmute yourself, my friend? The little speaker, if you're on your cell phone at the bottom. Hi, Patricia. Oh, you're loud. Oh, you're loud.
Hi, Mister.
How you doing? So
I'm good, and you?
I'm great, thank you. So I want
You cannot diagnose.
listen, observe, right? What is the word in this particular statement that tells you that this is not the best answer?
Diagnose.
What'd you say? I can't.
Diagnose.
Observe. So we're gonna observe the newly diagnosed. We're gonna observe the newly diagnosed patient. That is an observation/assessment, right? And if they're gonna be practicing techniques, that becomes teaching and education. Does everybody see that? So are we going to be delegating teaching, assessments, and education to our NAP? No, right? Thank you, thank you, thank you. So everybody sees Patricia, we're muting your back. But yes, the same type of psychology applies. You see these keywords, because this one doesn't say that we're diagnosing, Patricia. It doesn't say that we are diagnosing. It says that the client is newly diagnosed. So the key word that we're looking for here is the observing that client. And then look, this client is practicing injection techniques. So if that is, what is that? Is that a teaching? Is that an evaluation? It's evaluation, right? Because if the client is, we're gonna watch them do these techniques. So that means we're gonna evaluate. And if it's wrong, then it's gonna require some teaching, correct? This is not something that the NAP can do. Again, tape, 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 okay? So this answer choice, it involves evaluation and teaching as we stated. As per rule number 1, we cannot delegate evaluation of client care. So we know that we can eliminate this option, okay, good folks? So step 3 is we're gonna select an answer from the remaining choices that we have. So we broke it down. What do you good folks think the answer is in the chat? Let me know. What did we do? We broke down four options here. Does everybody remember what the best option was? That might be a little tricky because it's not in front of you right now, but yes, a Coco is on point. Answer 2, that is the best one because everything else had some level of tape in it. And if it does have tape in it, we know ixnay on the tape snay, right? So again, teaching, assessment, planning, evaluation, those things are RN only. If you're seeing selections that have any of that, put on your thinking caps. Know that there's going to be some keywords in there that you're going to be looking for. Observe, that's another one. Observe is evaluate. If someone says, like in the first option about, oh, what are we going to be delegating to the experienced NAP? That experience part is just a fluffer word. It's a distractor. Doesn't matter how experienced your LPA or LPN is or your NAP is. Experience doesn't matter because we know we're not to delegate any tape. Does everybody get that? So get it out your heads and don't think about the person that you work with who's been, you know, a home attendant forever, but she does wound care well. No, 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 we're not doing that. We're running the other way, okay? Experience is a fluffer. We are doing things by the book, okay? What does the textbook say? What does the nursing journal say? It says, I don't care how long you've been in this position. I don't care if you, as the CNA, has more experience than the RN in wound care. But guess who's not doing wound care? You, CNA, you're not doing it because you're not able to do it. There's tape in here. If there's tape in here, Miss RN, Mr. RN, we're the ones that are doing this, okay? They can sink on in. Let it rain, let it cover you. Let it cover you like rain. Okay. All right, so I think this is a perfect time for us to take a nice little fluid and electrolyte break. Get some water, hydrate yourself, make sure that you're good to go because we learned a lot. And we're gonna be putting these theories to practice, so I hope that you've been paying attention. So take a little breaky break, get a little snacky snack, and then come on back in 5 minutes. And this time I mean a real 5 minutes, because usually I say 5, I mean 3, but now I mean 5, okay?
Whatever.
All right, enjoy your break, good people.
I wanna love you and treat you right. I wanna love you every day and every night. I see something familiar. Oh yeah, yeah. The sensation in your eyes feels like it's drawing me nearer. Oh yeah, yeah. I never loved somebody like you. Somebody like you, somebody like you. I never thought that I'd be chasing after you. Somebody like you, somebody like you. Somebody like you. Somebody like you. Haven't felt that in a while. That infatuation for you. Deep and luscious ain't my style, but I'm loving your temptation. Yeah, yeah. That's the reason I never loved somebody like you. Somebody like you, somebody like you. I never thought that I'd be chasing after you. Somebody like you, somebody like you. Somebody like you. Somebody like you. Beauty and brains, you got it. Love and affection, I want it. You are something worth fighting for. Yeah, yeah. Baby, your love makes me want you more. I never loved somebody like you. Somebody like you, somebody like you. I never thought that I'd be chasing after you. Somebody like you, somebody like you. Somebody like you. Somebody like you. I never loved somebody like you. Somebody like you, somebody like you. I never thought that I'd be chasing after you. Somebody like you, somebody like you. Toda la noche rompemos, al otro día volvemos. Tú sabes cómo lo hacemos, baby. Baby, tonight's like fuego. We bout to spend a dinero. We party to the extremo, baby. Toda la noche rompemos, al otro día volvemos. Tú sabes cómo lo hacemos, baby. Baby, tonight's like fuego. We bout to spend a dinero. We party to the extremo, 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 extremo.
Ritmo.
No son ni Reebok ni Sonai, nah. Sin estilista luzco fly. La Rosalía me dice que luzco guay. No te lo niego porque yo sé lo que hay. Lo que se ve no se pregunta. Yo te espero y tengo claro que es mi culpa. Como Canelo en el ring nadie me asusta. Vivo en mi oasis y la paz no me la tumba. Hakuna Matata como Timon y Pumba. Voy pa' leyenda así que dale zumba. Los dejo ciego con la vibra que me alumbra. Haters pa' la tumba, nosotros pa' la rumba. Toda la noche rompemos, al otro día volvemos. Tú sabes cómo lo hacemos, baby. Baby, tonight's like fuego. We bout to spend a dinero. We party to the extremo, baby. Toda la noche rompemos, al otro día volvemos. Tú sabes cómo lo hacemos, baby. extremo, 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 extremo.
Ritmo.
Styles upon styles upon styles, I got several. Born to be wild cause I live like a dead devil. Live it up, hit 'em up, that's a scenario. Tupac, I get around like a merry-go rooftop. I am on top of the pedestal, flu shot. I am so sick, I need medical. I learned that shit down in Mexico.
The rhythm, the rebel. New and improve, I be on a new level. That's how we do it, we build it like Lego.
Hey, hey, hey. How was that break? Is everybody hydrated? Everybody feeling refreshed? Hopefully you got to use the bathroom, got to have some snacks, got to have some water. It's very important that we hydrate. I feel very strongly about that. Okay. All right, good folks. So we learned a lot. We are now learning how to consider these rules when we're coming up with our best answers. So what better way to make sure that it sunk on in and it hydrated you than to review?
I love it.
All right, good folks. So you know what that means. It's time to jump on in. Okay. All right. So review. All right, good folks. The first question of our review is as follows. The charge nurse is supervising the nursing care administered on a very busy medical surgical unit. Which of the following situations, if noticed, would require immediate intervention? Is it 1, a nurse talks with the patient's family with the patient's direct permission? 2, an LPN gathers all necessary supplies before entering the room of a patient who needs a sterile dressing change. 3, a UAP changes the linens on the bed while the patient with Meniere's disease ambulates to the bathroom. Or is it 4, an RN dressed in a gown and gloves before entering the room of a patient with localized herpes zoster? What do we think is the best answer here? Make sure that you're utilizing all of the tools we went over. What's step number 1? You got to reword that question, okay? Put the question in your own words and attack it as follows.
I love it.
With somebody who loves me.
Make sure you good folks are putting your selections in the chat. The question is in the black. I can't make it any bolder, but moving forward, I will consider that for you good folks. I got you covered.
I love it.
We'll both be numb, and she'll always get the best of me. The worst is yet to come, but at least we'll both be beautiful and stay forever young. This I know. Yeah, this I know. She told me don't worry.
Good folks, remember the question is asking us, if noticed, which would require immediate intervention. Make sure you know what the question is asking you, good folks. That was my bonus point for you or tip.
Awkward.
And I know she'll be to death of me, at least we're both numb. And she'll always get the best of me, the worst is yet to come. All the misery was necessary when we're deep in love. Yes, I know, yeah, girl, I know. She told me don't worry about it. She told me don't worry.
Kathleen, is this your submission for this question, or was this an older question? Did you just put this number 3 in for now, or was that for the past? I don't know, girl. Let me know. If you're tuned in, make sure your cameras are on. Hello, hello. I see Chadwick. Yeah, welcome. Cameras on, good people. We're here to party. We're here to party. Let's see. I need some answers in the chat. Answers in the chat. Don't leave me hanging. Good folks, we're still waiting for these answers to come in. For my people in the gallery, Uche, Cleo, Outpour, Kimmy, cameras need to be on. Cameras need to be on to participate. Make sure you're putting your cameras on or you will be kicked out of the class. Make sure that your cameras are on. We want to see your faces, participation, station. I'll call you out, I'll call you out. Again, if you're tuning in from a cell phone, if you look at your screen at the bottom left, you'll see a little camera icon. You can click that to turn on your cameras. If you're tuning in from your laptop, you can also look down at the bottom. You'll see a camera icon. You press that button and we can see your lovely faces. Cameras are required to participate. Okay, good people, I got some answers that poured in the chat. I got a lot of 3s. Welcome, welcome, welcome. We got a lot of 3s in the chat, a lot of 3s in the chat. Anybody not get 3? Because that's all I saw that went in the chat. Everybody else didn't put in the answer. So anybody else not get 3? I'm just like, I don't know what to put there. Just let me know. You can unmute yourself. But for the most part, we got a lot of 3s in here, right? So congratulations, good folks. That's what we were looking for. Answer 3, our UAP should be walking hand in hand with that patient that has Meniere's disease. So if you're not familiar with Meniere's disease, you know that one of the main characteristics of this particular disorder, that the patient will have dizziness, right? If a patient becomes dizzy, then what happens? They become at an increased risk for falls. It's a safety risk. So the safest thing is to ambulate with that patient. And so answer selection number 3 was the best choice here. And good job to you good folks that put that in the gallery chat. Appreciate it. All right, so we're not done. It ain't over. Okay, so the next question that we have, the charge nurse in the emergency department receives a call that 4 patients will be arriving immediately. They got different injuries happening. Based on the following reports, we're gonna put these in order of the patients first to be seen to the last to be seen. Good people, this is called triage. This is what is going to be required of you as a registered nurse, okay? So again, you got these 4 clients that walked into that emergency department. They all have different things going on. I need you to put in order of priority, the first priority to the last, okay? So let's read what's going on with these good folks. Number 1, an adult with an obvious deformity of the left forearm, a strong radial pulse, and complaints of extreme pain. Number 2, a child with a break through the skin and obvious deformity of the right leg who is pale and complains he feels dizzy. Number 3, an adult with no obvious injuries, a heart rate of 135 and confusion. And 4, a child who cries loudly with a cut on her forehead and a heart rate of 105. Now, once more, I'm asking you good folks to prioritize. Who is the priority here? Put it in order. Who are you going to see first, second, third, and fourth? So your answer selection in the chat should have 4 numbers in order of priority to the least priority. Okay, good folks? Let me know what you're thinking. You should have 4 numbers in order of severity. First patient you'll see to the last patient you'll see. Let's go. It's emergency room. Somebody's not gonna be seen. What's going on here? I wanna know who I'd like to work with. Mercy gets money points for having her first answer in the chat. You were first, girlfriend. Augustina, you should have 4 numbers in your selection in order of severity. Who are you seeing first? To who would you be seeing last, okay? Make sure you are paying attention to what the question is asking you and that you're putting them in order of priority, okay? Don't let this question be the type of question that gets you stumped. And there should not be 1 answer, there should be 4 answers. Augustina, your answer should have 4 in a row, 4 in a row. Good folks in the chat, I want everybody to just take a minute. Let me know, who are you seeing first? Who are you seeing first? What patient is the priority right now? Let me know in the chat who you're seeing first. Kathleen says we're seeing number 3 first. Is number 3 the first person that we're gonna be seeing? Let us know who you think. I got, Coco says number 2 is who we're seeing first. Patricia says number 4 is who we're seeing first. Let us know, who are we seeing first? Who is the priority here? Kathleen, I'm gonna come to you. I'm gonna ask you to unmute yourself. Let us know why you chose number 3, the adult with no obvious injuries and a heart rate of 135 in confusion.
I think can have a heart attack, tachycardia, right?
So you would see that patient first?
Because that patient is at risk to have a heart attack.
In the chat, let me know what is the normal range of heart rate for an adult. What is the normal heart rate range for an adult client? In the chat, let me know. I want to know if you know that vital sign. What is the normal range for a heart rate for an adult client? In the chat, what is the range? Kathleen's got a range in there. All right. In the chat, let me know. It should be fast. We got only one answer in there. Only one. Rose has an answer in there. All right. So, back to Kathleen. This particular client, in number 3, okay? This person is what? Tachycardic, correct? Tachycardic and confused. Does anybody else think that this is the priority patient that we should see first? Because an elevated heart rate and confusion, does that person then become a person who is at risk for an immediate change of status? Is this person at risk for an immediate change of status? Yes or no, good folks, in the chat. Let me know. Let me know. Yes or no? In the meantime, we had some number 2s in terms of who would be prioritized. Number 2. If you chose number 2, unmute yourself. Let's know why you chose number 2. Who chose number 2? Mercy, you chose number 2. Mercy. Hi, Mercy.
Hi, please could you just read the number 2 option for me so that will be exact?
All right, so let's see. We'll show the questions again.
I don't really see it. I only just hear it from you. It's so small.
Okay, so number 2 says that a child with a breakthrough the skin and obvious deformity of the right leg, who is pale and complains he feels dizzy. This is the one that was the priority, right, for you, number 2, right? Why did you pick this one? How come this one was a priority?
Yeah, because of everything that is involved, and the child was able to say that the child is pale. If the child is pale, it shows that maybe the child is probably anemic, and the child is confused too and is dizzy. So the child could just slump and maybe give up.
Okay, well, you hit a lot of good points there, right? Because I'm going to piggyback off of what you said and kind of bring it in more. Okoko, did you want to add something, Okoko?
Yeah, I think considering the ABC, the patient has a circulation. The circulation is compromised. I think the patient is hypoxic, which is a concern, which is the cause for concern, because there's loss of circulation, using the ABC as a standpoint.
All right, so we're using the prioritizations that we reviewed, right? So this child, let's take in what we know about this child. This child has an obvious deformity with a break through the skin, right? So we know that there's trauma. There's a broken bone that they have there, okay? So with that being said, as Okoko mentioned, circulation is impaired. Now you have this break through the skin. The child is becoming pale, right? And they're saying that they feel dizzy. So as Okoko mentioned, the ABCs are affected here. If the child is now becoming pale and complaining of feeling dizzy, it's likely that this child is now going into shock based off of what happened to them. You had a break through the skin. Everything is like, right? So now you're losing blood, you're feeling pale, or you're going pale and you're feeling dizzy. That is a sign that this client is about to pass out, and it could be a shock related situation. Does everybody see that? All right, so let's jump in. Great job. Let's jump in, okay? So the best answer in terms of triage and prioritizing the care for these 4 individuals that have come into your emergency department, congratulations, because I saw a lot of these answers in the chat, okay? 2, 1, 3, and 4. So for number 2 rather, this is who we're prioritizing. This child is now having a change in the level of consciousness. Does everybody see that? That matters. ABCs, then to Maslow, okay? So a child with a break in the skin is going to be the first one that we're seeing. Number 2 person that we're going to see is the adult that has the obvious deformity, strong radial pulses, and complains of extreme pain. The next one that we're going to see is the adult that has no obvious injuries. There's nothing pertinent for us to deal with here. Does everybody see that? All right. All right. So that'll be the person. And then the 4th one is just the child that's complaining with the cut on the head. So don't get sidetracked because it's a child. Don't say, oh, the child automatically should be seen before the adult. No, we're prioritizing and we're triaging based off of the ABCs and Maslow's hierarchy of need. So great job to you good folks, okay? So as I stated, pay attention to the changes of the level of consciousness. That in itself is an indication of shock, especially if there's been some type of injury that has occurred, all right? So the becoming pale, changing of the consciousness level, shock, okay, good folks? So with no obvious injuries, that means it could be some internal bleeding or something that might suspect that there's some type of internal hemorrhaging. So that's the reason why we're going to think about the pain and all those things that this person is complaining of. But then the child who's pale, again, they're going into shock. They should be seen. See the adult in pain. The child could be upset about the cut. Doesn't really matter. You're okay. We don't have to do anything spectacular or immediate for that particular client. Again, great job. All right, that was kind of like a select all that applies with some order, and you guys rocked it. And I feel like you are seeing how to apply the ABCs, Maslow, into picking the best answers. But guess what? We're not done. Moving on. Next question. This one is going to be about ethical and legal issues, because this is also a part of the management of care. So I want you good folks to make sure that all these little subsets that I'm giving you, that you make sure you review certain things in those categories, because it's important for you to know, okay? So again, the question here, the nurse hears a client calling out for help, hurries down the hallway to the client's room, and finds the client lying on the floor. The nurse performs an assessment, assists the client back to bed, notifies the healthcare provider of the incident, and completes an incident report. Which statement should the nurse document on that incident report? 1, the client fell out of bed. 2, the client climbed over the side rails. 3, the client was found lying on the floor. 4, the client became restless and tried to get out of bed. Which one do you good folks think is the best selection here? Let's go. I don't think you good people need a lot of time on this one, because you are RN extraordinaires. Augustina, do you know that? Do you know that for sure? Do you know that? We know we can't tell Augustina nothing. She gonna fill in the blanks. She gonna be like, what had happened was.
You see, I'm so confused today. I don't know what's going on with me.
No judgment, Augustina. We love you to sing. We love you to sing. This is why we're here, good folks. This is why we're breaking it down, because we're making sure that we don't make the same mistakes in real time, right? We're not reading too much into the questions. We're taking it exactly how it is. We're getting better and better every day. Okay, good folks? Let's read this question again. The nurse hears a client calling out for help, hurries down the hallway to the client's room and finds the client lying on the floor. What do we know to be true here? In the chat or unmute yourself. Let us know what is true here. What do we know that is a fact? What is the facts here? Ashley?
The nurse found him lying on the floor.
Exactly. That is a fact. The fact is that the client is on the floor, right? We just heard the client scream and we ran to the client's room. So we know the client was in their room and they're on the floor. Do we know anything else for a fact? Do we know that they fell out the bed? Could it be that their legs buckled? Who knows, right? We don't have any other facts about the situation, about what happened. All we know is we heard the client scream, we ran to the room, and now the client is on the floor, right? Ashley picked that up. All right, let's go back and look more at this question. So we know for a fact that the client is just lying on the floor, okay? Then the next thing we know is that we did an assessment, we assisted the client back to bed, we let the care provider know what happened, and we did our incident report, okay? So with that being said, once we broke down the things we knew for sure are a fact, which of these selections then become the best answer? Let's look at them again. Augustina, look at the options again. Knowing what we just said, what facts we know for sure?
Yeah, the answer is 3 because the nurse found the resident on the floor. I'm so confused today. I don't know what's going on with me. I'm sorry for today.
Don't be. As long as you're able to make it back around, right? Are you able to see what we just did there? We broke down the question. We didn't add extra stuff. We didn't say, oh, he fell. Oh, his cousin must have said something on the phone and got him all worked up and he jumped over the side rail. That's not what it said, right? So we're going to stick with what is in the question. We're not putting extra things and we're not painting more pictures, okay? So make sure that you take out that, whatever it is in you that makes you want to assume other things or to add on to create a lovely story. This is not story time, girlfriends and boyfriends. It is not that, right? We're sticking to what is in the selection. So as we jump back in, we know that the fact of the matter is the client was just on the floor, okay? So with that being said, as you now corrected yourself, which is a great thing, applause for you, right? We don't beat ourselves up. We can and we will up in this part, right? Okay, so the best answer is answer 3. The incident report should contain the client's name, the age, diagnosis, and the report should have factual descriptions of what happened. Anything else is just speculation, okay? So make sure you're putting a factual description of that incident. Any injuries that they have, you're gonna describe those as well. No assumptions, all right? So the correct option is the one that has the facts. Options 1, options 2, and option 4, they're just interpretations and they're not factual. That's just extra stuff that was added, right? But again, as we're documenting, we're only stating the facts. Good job, good folks. All right, we have another one under legal here. Nursing staff members are sitting in a lounge, they're taking their morning break. Then the unlicensed assistive personnel, which is a UAP, tells the group that she thinks that the unit secretary has AIDS, y'all. Ooh. So, and then she proceeds to tell the nursing staff that the secretary probably contracted the disease from her husband. Oh my, Augustina, you listening? This is juicy, okay? So the husband supposedly is a drug addict. So now, which legal tort has that UAP violated? I'm sure we hear some of these things happening at the nurses station, but check it all in. What then has this person violated? Let's get to it. I see those answers coming in. I see those answers coming in. And if it's happening at your unit, then I know it's gonna be problems. All right, good people, good job. I didn't even have to spend too much time here because you got it. The answer is number 2. The answer is number 2. Defamation. Defamation is a false communication or a careless disregard for the truth that causes damage to someone's reputation. If it's in writing, that would be libel. Or if it's verbally done, that in itself is slanderous. Good job. Mercy, yes, unmute yourself. What's your question, Mercy?
Hi, Mr. Please, I'm sorry if I'm asking too much.
No,
I can't even see the option.
You couldn't see the options?
No, not at all.
All right, so we'll go back. The options here were 1, libel, 2 was slander, 3 was assault, and 4 was negligence. All right, but the best answer for this particular one with the UAP talking about the secretary to the other members of the team, it was slanderous. She was spreading slanderous rumors about her coworker, all right?
Thank you.
No worries, no worries. All right, so if it was an assault, assaults would be when a person puts another person in a harmful or offensive contactual situation, okay? Negligence would involve the actions of professionals that fall below the standard of care within a specific professional group, all right, good folks? Make sure that you're able to differentiate the differences between those particular things. That's why I put this particular question here, so that way you know negligence, libel, slander, etc., and great job too. All right, good folks, the next one. The nurse who works on the night shift enters the medication room and she finds a coworker with a tourniquet wrapped around the upper arm. The coworker is about to insert a needle attached to a syringe containing clear liquid in the antecubital area. Which is the most appropriate action by the nurse? 1, are we gonna call security? 2, call the police? 3, call the nursing supervisor? 4, lock the coworker in the medication room until help is obtained. What are we doing? I see those answers coming in. I see those answers coming in. We're breezing. The answer is 3. It's 3. The Nurse Practice Act requires reporting impaired nurses. So if any of your friends are getting high on a unit, you better tell somebody. The Board of Nursing has jurisdiction over the practice of nurses, and they could develop plans of treatment and the supervision of that impaired nurse, but you have to report that, okay? That incident will need to be reported to your nursing supervisor, and whatever else needs to happen from there, not your business, but the best thing to do is to report that. We could call security if there's, I don't know, you don't need to. That's not the best answer, right? It's not the most appropriate, but we know that this person does need to be reported. It's not okay. Okay, good folks? We got another question though, okay? Which of these identify accurate nursing documentation notations? This is a select all that applies question, okay? Which identifies accurate nursing documentation notations? So when you're writing your nurse's note, which of these are going to be added? Which statements make sense? 1, the client slept through the night. 2, abdominal wound dressing is dry and intact without drainage. 3, the client seemed angry when awakened for vital sign measurements. 4, the client appears to become anxious when it is time for respiratory treatments. And 5, the client's left lower medial leg wound is 3 centimeters in length without redness, drainage, or edema. Which is the best? Select all that apply, good people. Remember, we're looking for accurate nursing documentation notations. What would be an accurate thing to put in your nurse's notes? I see something sexy in the chat. I see a right answer in the chat. Not all of them, but I saw one. I see a lot of 4s in the chat. Let's read number 4. The client appears to become anxious when it is time for respiratory treatments. Is that a fact? Is that a fact, good people? Let me know in the chat. Is number 4 a fact or no? We got the answer here. 1, 2, and 5. We're looking for factual documentation, right? Number 4 was an assumption. It was you putting on what you thought the client appears to be. No, that's not a fact. Factual documentation is descriptive. It is objective information, and it should be pertaining to what you see, what you hear or smell, and by feel is not what you feel emotionally, is what you feel via palpation, via touch, okay? Not what you feel in your heart, okay, good folks? The use of inferences, if you don't have supporting factual data, it is not acceptable because that can be misunderstood. The client appears to be anxious when I come in. No, what did you see? Client heart rate, client, respiratory rate. Speak to the factual data that you collected in order to validate your statements, okay? If you're using vague terminology, it's not going to be acceptable. It's if people have to guess about how you came to this determination. So again, when you're documenting, make sure that you're using information from your actual observations. All right, good folks? So before we wrap it up, I wanna make sure that you good folks understand what it is or how it is that you should be approaching these styles of questions. Make sure that you are paying attention to the ABCs, Maslow's hierarchy of needs. If you understand what those are, then you'll be better suited and able to differentiate when you're delegating, okay? And then another thing in the chat for your extra MVP credits for the day, what is the tool to help you realize what the RN should be doing? I said it a lot today. I'm hoping that you good folks can hit it up in the chat. Let me know. It's a sticky word. It's a sticky situation. Tape, tape, tape. Yes. All right, good folks. So again, use these strategies as you are approaching any of your tests, any examinations. My good folks, that some of you I think may have scheduled for your NCLEX exams, in the chat, just drop something in the chat. Let me know if you are actually scheduled to take your boards anytime soon. If you are, or whether you're not, make sure you are doing review questions. I want everybody to be doing review questions for the week. Set yourself some time aside to make sure that you're getting those things done. Practice makes perfect, right? So challenge yourself, make sure that you're using the tips and tricks that we talked about today, and you should be set for success. Always think tape, good people. Thank you for showing up. We had a lovely, lovely class. You guys participated well. And I feel like you did really good on the questions, so your minds are expanding, and I'm happy for you, good folks. Have a beautiful rest of the day. I look forward to seeing you good folks next time when we do our NCLEX review. And shoot me a line if you have any questions, suggestions, or things that you feel like you're struggling with. I am here. I am here. Beautiful day, good people. Love and light. Love and light. Enjoy your day. Thank you.